Thank you very much. That's why. As we have heard, the vaccines are around the corner, and we thought it was important for us to speak to you, the general public, as regards the importance of vaccines and vaccination. Now, what is a vaccination? It's a simple and safe and effective way of protecting people against harmful disease before they come in contact with them. It uses your body's natural defenses to build resistance to specific infections and make your immune system stronger. In other words, you're able to fight these diseases and not get sick. So vaccines train your immune system to create antibodies or proteins, just as they do when they're exposed to the disease. The vaccines contain only killed or weakened forms of the germs, that is the virus or bacteria, and do not cause any significant risk or complications to the person who is receiving the vaccines. Now, most vaccines are given by injection, some are given by mouth, and some are given by nasal spray. The COVID-19 vaccine will be given by injections. We know that there are a number of persons in our community who are afraid of needles, but it's just a little stick that you will get to save your life, and so please don't run away just because of a little needle stick. Now, some persons may ask, why is it important to be vaccinated? Today, there are vaccines available to protect against at least 20 diseases, and some of them we know about them because we would have been vaccinated against them as children: tetanus, pertussis or whooping cough, polio, and measles. As a matter of fact, vaccines save over 3 million lives each year. And when we get vaccinated, we are not just protecting ourselves, but we are protecting those around us. We see here in the image I have projected leaders from the UK and the United States who are taking their vaccines, and very soon, the next time I give this presentation, we'll be having persons in leadership positions right here in the Federation who would have been rolling up their sleeves to take the vaccine as a lead for you, the general public. Now, it's not everyone who can take a vaccine. There are some persons who, if they're seriously ill, very young babies or people who have severe allergies, they may be advised not to take the vaccine, and they depend on the rest of us to get vaccinated to help reduce the spread of the disease to them. Now, we are not reinventing the wheel. As I said, there are over 20 diseases that persons would have received vaccinations for, and that's a list of some of them. We know about polio, rabies, rubella, tetanus, typhoid, yellow fever, mumps. And so COVID-19 is just another one that will be added to the list. Now, we have spoken about the concept of herd immunity. When a person gets vaccinated against a disease, their risk of infection is reduced. So they are also less likely to transmit the disease from one person to another. And the more people in a community who get vaccinated, the fewer people remain vulnerable, and there is less possibility of an infected person passing the pathogen on to another. And so, for example, if all of the persons at our ports of entry and the frontline workers were vaccinated and they came in contact with an infected person, the chance of they taking that infectious agent home and reinfecting other persons is significantly reduced. Therefore, lowering the possibility of the pathogen circulating in the community when we get vaccinated. So herd immunity is the indirect protection from an infectious disease that happens when immunity develops in a population, either through vaccination or through previous infection. Because COVID-19 is so deadly, we don't want to get immunity through infection, and we also do not know how long the immunity lasts when you get an infection. Therefore, the safer way of protecting yourself is by getting the vaccination. Now, we know that there are a number of vaccine trials out there. There are over 60 COVID-19 vaccines undergoing trials right now. However, despite the fact that there are so many vaccine trials, there are only a few that have been given emergency use authorization. And it means, therefore, that the protocols and procedures in place before a decision is made for them to be placed into the arms of the general public is very, very strict and very rigid. And so once a vaccine comes on the market for use, it means that it would have gone through significant, rigorous testing and is therefore safe. The World Health Organization has been working in collaboration with a number of other agencies to accelerate the development of these vaccines so that we can address this pandemic, which is very deadly, and bring it to an end. The speed, therefore, at which these vaccines are being developed is not because of any shortcuts, but because of significant financial investment that was made into their development and also advances in science and technology. We have heard about the first two vaccines that came on board, the Pfizer-BioNTech and the Moderna, and these are mRNA vaccines where a protein is injected and make the person develop the protein that is present on the COVID-19 vaccine, on the COVID-19 virus, and then you can develop antibodies to this and protect yourself. The protection offered by these vaccines is over 90% for both of them. The Pfizer vaccine is given 3 weeks apart, the Moderna 4 weeks apart, and they're indicated for persons over the age of 16 and 18. The problem with these vaccines is that they require special storage to maintain the cold chain. The Pfizer is stored at minus 70 degrees and the Moderna at minus 20, minus 30 degrees. Now, the regular refrigerator goes down to 4 degrees. And you can see then that if one were to use these vaccines for worldwide vaccination, you would require special storage, and a number of third world countries would have great difficulty in getting that sort of storage. Therefore, the quest for more vaccines that were easily available continued. The other one that came onto the market was the University of Oxford, AstraZeneca, and this is a vaccine that is also injected. The protection is between 70 to 90%, which is less than the first two that I mentioned. However, when I speak about vaccine efficacy, you will see in the long run, this might not really matter. The doses can be given up to 4 weeks or even longer. They are advocated for persons over the age of 18, and it can be stored at refrigerator temperature between 2 to 8 degrees for up to 6 months. The other vaccine, Johnson & Johnson, that has not yet received emergency use authorization, but has great promise because it's a one-shot vaccine, and therefore, once somebody gets one shot into the arm, there is no issue with trying to follow them up 3 or 4 weeks later to get the other shot. And most experts think that this vaccine, once it gets emergency use authorization, is the one that would be used most widely around the world because it also requires storage at a refrigerator temperature and no special deep freezing to keep it safe. Now, this comes to the issue of vaccine efficacy, because sometimes persons will look at the absolute numbers and they see that the Pfizer-BioNTech is 95% effective, whereas the AstraZeneca might be between 70 to 90, and they might say, well, I would want to get the Pfizer-BioNTech as opposed to the AstraZeneca. Now, what is vaccine efficacy? Vaccine efficacy is the percentage reduction in disease incidence in a vaccinated group compared to an unvaccinated group in a clinical trial. Now, it's important for you to know that in a clinical trial, there are special exclusion criteria. In other words, we don't do clinical trials on little babies or the very old and the frail. And so most persons who enter into a clinical trial would be relatively healthy young adults. So the exclusion criteria might be age, pregnancy, or particular health conditions. Now, once the vaccine goes to market and is being put into a person's arms, the persons who would be receiving the vaccine would be quite different to those who were in the clinical trials. And so the ideal conditions of a clinical trial do not necessarily reflect what happens in the real world. And the vaccine effectiveness tells us how well a vaccine works under real-world conditions once persons outside the clinical trial receive the vaccine. And this will also depend on a number of things like the person's age, if they have any comorbidities like diabetes, hypertension, coronary artery disease, previous exposure to the disease, how long since they were exposed to the disease or vaccination, and also the development of variants. For example, we recently heard about the development of variants and the fact that some vaccines may not be as effective in limiting mild disease against the variants. Now, it's important then for us to understand what is a variant and not be too surprised when we hear about the development of variants. When a virus makes copies of itself, it's sometimes changed a little. And when I say makes copies of itself, when one becomes infected with the virus, it multiplies within your system, and so it's making copies of itself. And as long as the virus is circulating for some time, we will have little changes occurring on the surface. And the changes that occur where a new virus that is slightly different from the previous one develops. These are called variants. Now, these changes, when they occur, makes the virus more adaptable to its environment. And so the changes can result in increased transmissibility of the virus or increased severity of the disease. The known variants that we know of now, they have an increased transmissibility, but there is no documentation that they have an increased severity. However, once you have a virus that is more easily transmitted, it means that you may have more persons coming down with the infection. And if you have more persons coming down with the infection, the healthcare system can become overwhelmed and you can have an increased death, even though the severity of the disease caused by the variant is not significant. And so it's important, therefore, for us to do everything that we can to keep the variants out of our tiny federation. Now, when we speak about the efficacy of the COVID-19 vaccines, it's important for us to also look at the efficacy of previous vaccines. For example, there are very few vaccines that reach 100% efficacy. You need to move forward on the slide. Yes, there are very few vaccines that reach 100% efficacy. The flu vaccine, for example, there are many persons who take the flu vaccine each year, but you'll be surprised to learn that the efficacy has been as low as 10% in 2004 and as high as 60% in 2020. And the average efficacy of the flu vaccine ranges between 40 to 60%. Last year, it was 45%. Despite the fact that these figures might sound pretty low, the effectiveness at controlling the flu was quite significant. Therefore, you cannot just look at a little 5 or 10% difference in efficacy of vaccines and determine that you will want the one with the higher efficacy. If we look further down the slide, for example, mumps, the efficacy is 88%. However, none of us in the last 10, 15, 20, 30 years have seen someone in St. Kitts with mumps since we started the widespread immunization of mumps, despite the fact that the efficacy is only 88%. And so there are very few vaccines that reach an efficacy of 100%. Tetanus and polio, after you have completed your doses, they have an efficacy of over 100%. Now, some persons ask, who will be vaccinated first? The recommendations by the World Health Organization has 3 goals in mind. 1, to decrease death and serious disease as much as possible. 2, to preserve a functioning society, which means that key persons in the society important for its functioning have to be vaccinated. And 3, to reduce the extra burden COVID-19 is having on people already facing disparities, which means that persons who are disadvantaged, persons who are in close clusters, low-income families where they are in areas where they have to be bunched close together, these persons have to be given priority. So the criteria, it's quite broad, but very important. Now, I will speak just briefly as to the phased approach from the World Health Organization, and when Dr. Hazel-Laws comes to speak, she will speak specifically about our criteria, because we have learned all along that there is no one-size-fits-all approach, and this approach that was outlined by the World Health Organization was addressing mainly countries that had community spread. But we do not have community spread here in St. Kitts and Nevis, and so our focus should be more on strengthening our borders and making sure that there is no importation of the virus. So the rollout should be phase 1A, which are healthcare personnel and persons in long-term care facility. Phase 1B, mainly the frontline workers and persons over the age of 75, because these persons are at a higher risk for hospitalization, illness, and death from COVID-19. And phase 1C, once we've vaccinated the persons above age 75, persons between the ages of 65 and 74, and people between the ages of 16 and 64 with underlying health conditions, and any other essential workers who were not included. The ultimate goal, however, is to have everyone vaccinated. But while we're moving towards this goal, and don't forget, our plan here in St. Kitts is to have more than 70% of the population vaccinated. But while we're working towards this goal in having a safe, effective, and fair rollout of the vaccine, we must continue the essential public health action measures that we know to suppress the transmission of the disease and reduce mortality. Some persons also ask, you need to move forward. Some persons also ask, should the vaccine be mandatory? Now, to be properly protective, COVID-19 vaccine needs to be given to most, if not everyone, because it's only through widespread vaccination will we reach herd immunity. And being vaccinated, we know, significantly reduces your risk of getting severe disease and death, and also significantly reduces your risk of spreading the virus to someone and harming someone. Now, this, by you getting vaccinated, it's at a minimal cost to you and society. The alternative would be community spread and lockdowns, which would cause great which will come at great cost, not to just you, the individual, but to society. We, however, believe that we can achieve herd immunity through less stringent measures, such as a campaign of education and making sure that everyone buys onto the idea of getting a safe vaccine in their arm to prevent the spread of COVID-19. We are always asked then, if someone is vaccinated and they come to St. Kitts now, will they still need to be quarantined? The decision lies in your hands, because until we get to a state of herd immunity, we will have to continue quarantining persons who come into the Federation, because being vaccinated doesn't necessarily mean that you cannot spread the disease. Being vaccinated protects you from getting severe disease and death, but you may be asymptomatic or you may have mild disease, and during that period you may still transmit the virus to someone else. And so while we remain virgin territory with no exposure to disease, until we get herd immunity, we would have to continue with these protocols and procedures. Some persons may ask, if I got COVID-19 already, should I be vaccinated? The vaccine should be offered to everyone, regardless as to whether or not you had previous infection. However, if you are currently having an infection, it is best to wait until after the infection is resolved before you are vaccinated. Also, studies have shown that persons who had the infection, they have some degree of immunity, and the chance of them getting another infection within 90 days of a previous infection is significantly lower. So once there is a vaccine shortage, these persons can wait and let other persons who have no immunity at all step out of the line and have the vaccination. Persons have asked whether or not the vaccine is recommended for pregnant women. Now, pregnant women who contract COVID-19 are at increased risk of poor outcome. In other words, they're more likely to have severe disease and probably even death. The World Health Organization therefore advised that those who are at high risk of contracting the virus through work or having underlying health conditions which predispose them to develop complications from the virus should take the vaccine in consultation with their doctor. Although available data does not indicate safety concerns, there is insufficient evidence, however, to recommend routine COVID-19 vaccination of pregnant persons. And so here in our federation, we will not be routinely giving the vaccine to pregnant women. And if we have a pregnant woman who's working on the front line, that would put at risk for getting COVID-19 infection, and the prudent decision would be to put them into a safer job position so that they would not be exposed to the virus. Now, lastly, some persons will ask, well, with the vaccine here, and hopefully we'll be having our mass rollout sometime soon, how quickly will we see the end of this pandemic? And we say no one is safe until everyone is safe. And that is one of the reasons why the World Health Organization is attempting to have 20% of the entire world population immunized, whether their economic activity, whether or not you're rich or poor. Because the ending of the pandemic depends on a number of things. Number one, how effective vaccines are. And we know that the vaccines that are being rolled out, they are pretty effective. How much can be produced and get into the arms of persons, because having a vaccine in a refrigerator is not going to be effective. We need to make sure that people come forward and have it in their arms, because that is the only how we can achieve herd immunity. So we need to have as many persons coming forward to get vaccinated. Here in St. Kitts, because we've been functioning in near normalcy, because we do not have community spread, there's a sense of complacency that is stepping in, and there's some vaccine hesitancy. But I want to warn you that complacency and inaction can be just as deadly as the virus itself. The number of cases and deaths in the United States is beginning to drop. The vaccination schedule is increasing, and the President of the United States said that he hoped by the end of July to have the entire USA vaccinated. I can assure you that once the cases drop in the United States and once they have their population vaccinated, they'll be making rules and regulations to limit travel to persons who do not have the vaccine. And it's important for us to continue the journey that we have and move forward towards successful herd immunity in St. Kitts and Nevis, so that we would have gone through this pandemic without a single death, because every life is important. Thank you.